Today, our esteemed guest is Steve Faraone, who, among his many titles and accolades, is Distinguished Professor of Psychiatry and Behavioral Sciences at SUNY Upstate Medical University, a lecturer at Harvard University, and president of the World Federation on ADHD, and author of more than 1,000 journal articles, editorials, chapters, and books. Steve, our mission is to make sure that girls with ADHD get diagnosed early. So I want to start off by asking you, how are we doing? How's the educational system and the medical system doing with that?
It's getting a little bit better, but not as good as it needs to be. Girls with ADHD tend to be primarily inattentive. They don't cause trouble in the classroom. They don't run around, climb on furniture. They don't get into fights with other kids as much. Some of them do, but not as much. Because they're have almost a silent ADHD, where they're sitting in the classroom, maybe looking out the window, not paying attention. They don't get recognized, particularly if they're above average intelligence. Perhaps they didn't have ADHD, they would get A's, but if they're getting B's and C's, they're teacher's happy, they're doing okay, and no one's worried about them. The problem with mental health problems in kids is that when you're a child, you get taken to treatment if you're causing someone else a problem. And it changes when you're an adult. When you're an adult, you can go to someone because you're having a problem. You feel it internally. When girls with ADHD grow up, they realize they have a problem and they refer themselves to treatment. I was happy to see in the latest reports from the CDC that the rates of diagnosis of men and women with ADHD equalize now. The diagnosis of women are even a little bit greater than men. Women are doing a good job of learning about ADHD and referring themselves for treatment.
But just a couple decades ago, it used to be that there were 10 boys to every girl who were being diagnosed. How
That's
are we
right.
doing now?
It's pretty similar because the dynamic hasn't changed. The Inattentive ADHD Coalition is trying to do a lot to have girls screened, so to educate practitioners about the inattentive girl and what it means for them to have ADHD. But because they're not causing as many problems as the boys, it's improved a little bit, but really, I would not say dramatically.
Oh, so you're saying by age 8, 10 times as many boys are being diagnosed at
Yeah.
that?
In childhood, boys are more likely to have ADHD than girls. The ratio is about 2, 3 to 1, boys to girls. So there's a real sex difference. Practitioners learn that ADHD is more common in boys, and they become less likely to look for it. I think that kind of perpetuates the problem that we're seeing with girls being underdiagnosed with ADHD.
So you're saying the prevalence is a little bit higher in boys, maybe twice as many boys as girls. But
Exactly.
how come when they're adults, women are now catching up?
They're catching up because I like to describe ADHD as an interaction between the challenges of the environment on our abilities to self-regulate. As we transition from childhood to adulthood, there's this massive change in the requirements for the brain. That all of a sudden we get a job, go to college, have a baby. The need for self-regulation, those demands become intense. The other problem with underdiagnosis is that you can have people who have inattentive ADHD and they're getting along okay enough. Even as they're teenagers, they might even not feel it. And even as a young adult, they might not feel it. But when they hit some transition point, like the first child in the family, then things fall apart. They seek help because something's not right. If they're lucky and they get a good practitioner, they're going to get diagnosed. The problem we have is that not all practitioners, particularly in primary care, are well trained to diagnose ADHD.
Given that it's so important to catch girls earlier so they don't have this great toll of comorbidities, anxiety, all the problems that we hear so much about, what do you think schools and parents could be doing better?
Of course, I don't like to blame parents for not doing a good job because parenting it's very, very tough, even with kids that don't have problems. Parents typically are not well educated in mental health. And so they're not thinking about a mental health problem for their child. Typically, a parent starts to worry when someone tells them there's a problem, especially with the first child, right? With the first child, parent doesn't know what to expect. Sometimes, even with an ADHD boy that's running around like mad and causing all sorts of problems, many parents are like, maybe this is what kids are like. They don't have exposure to a lot of young kids. It's not until preschool or regular school that a teacher says, your child's a bit different. And you might think about talking to your pediatrician about it. Teachers, on the other hand, are very good at comparing kids because they see the full spectrum of kids. They have a good sense of this is unusual. There is some hesitancy on the part of some teachers to tell parents because they don't want to get in trouble for that. In some jurisdictions, teachers have gotten in trouble for suggesting that a child had ADHD. That's unfortunately makes it harder for teachers to be very direct about referrals. And the most a parent can hope for is a teacher might say, your child's a little unusual. You might talk to your doctor. So they're not going to say, I think your child has ADHD. many cases, they're told not to ever tell parents, I think your child has fill in the blank.
It's a
Um,
minefield for good reasons. But
yeah.
given that girls are so hard to detect and teachers have these sensitivities, they're constrained. Do you have any advice for teachers? What if a teacher came to you and said, I'm really concerned that a lot of girls are slipping through the cracks and I want to be more attuned to what I'm seeing?
With the teachers, they the only way they can detect the problem like this is to figure out, is this child not performing as well as they ought to? A good teacher, it depends, of course, on many school districts in the United States that have different rules, regulations, and testing procedures. In many school districts, kids are given aptitude tests, and the teachers have a general sense that this child should be getting A's and B's. If that child's getting C's and D's, that's a red flag that something's not right. If it's not obvious what's not right, it's a good chance it's inattentive ADHD. If a child has autism, that's usually obvious. If a child has a disruptive disorder, it's pretty obvious because they're disrupting the classroom. I would say to most teachers, if you detect that kind of difference, that's a reason enough to talk to the parent about it at the parent-teacher conference. Say, we're seeing this difference here, and it really doesn't make sense to me. I think your daughter or son could do much better. You ought to talk to a professional about it and then see where that conversation goes.
That sounds like great language to use for a teacher. Are there any other telltale signs that you would recommend a teacher look for?
We say girls are primarily inattentive. It doesn't mean they can't be hyperactive or impulsive. Typically, they won't be hyperactive in the sense of running around and climbing on chairs. The teacher's likely to see some impulsivity in them, working perhaps too quickly through their worksheet, not checking for errors, things of that sort. They could think this child doesn't seem to remember things as well as they should. That's not a symptom of ADHD, but it's something that's unusual. Any unusual cognitive signs are things that they should look for. Is the child not processing information the way I think they should based upon what their aptitude is?
Acknowledging that teachers are overloaded and we may expect way too much of them, is it reasonable to say that they should try to pay attention to what's going on the playground and notice if girls are being picked on or don't have a lot of friends?
Teachers ought to know about the kids' social relationships. Absolutely. They can see that in the classroom, they can see it on the playground. They can't be, they need a breather too during their day, teachers for sure. We can't say you have to be observing throughout the entire school day. Even in the classroom, they can see how the kids interact as they walk into the classroom. They can see sometimes who's getting bullied, who's not getting bullied, who's ostracized. Kids are very sensitive. It's really interesting. I remember actually someone years ago invented this little psychological experiment where they would go into a classroom and tell the kids, we're going to put on a play and everybody's going to play a role. We want you to vote for who should be in what role. Some of the roles be king and queen. Some role might be the jester, the joker. Another role might be the evil villain. So there were all sorts of like positive and negative roles built into this play. And turn those into ratings of the degree to which kids were rated as good or bad in the classroom. It turned out those kids' ratings were pretty decent predictors of who had mental health problems 2 or 3 years later.
Wow, that's really
Yeah.
interesting.
Exactly. Kids are pretty sensitive to differences, in some ways more sensitive because they know, like a 6-year-old, a 6-year-old kind of knows if someone's not relating as like a 6-year-old should relate. If there's something odd about it, something negative about it. So kids are really sensitive. In fact, Dr. Pelham, once he asked me, how long do you think it takes in my summer camp setting? I have a bunch of kids with ADHD, I have a bunch of kids who don't have ADHD. How long does it take for the other kids to realize who doesn't have ADHD based upon behavior ratings? I said, I have no idea. By lunch on the first day, they can
Wow.
tell who are the kids with behavior problems and who are the kids without behavior problems. Kids are very sensitive, but that sensitivity frequently leads to kids being ostracized or bullied, set apart in other ways, and not participating in the active social life they should have. That's a clear sign. It's not always a sign that person has ADHD. They could have some other problem. It might not even be a mental health problem, it could be something different, but it's a sign that there's a problem. It's something the teacher can take back to the parents. Johnny or Jane is just not relating to other kids as well as they ought to. And I'm worried if we let this get out of hand, that could be a problem in a few years.
My uncle was a child psychiatrist, and when we were trying to decide whether to give our child medication, the one question he asked is, does he have friends? He didn't ask about his aptitude or how
Yeah,
he was performing
yeah.
on tests.
That's a great point you mentioned because one of the misunderstandings about ADHD, I'm glad you mentioned it, because originally, I'm talking back 60s and 70s, 80s, it was thought of as a cognitive disorder. That it was due to the ability of people to think correctly and the ability of the brain's thinking mechanisms to control a person's behavior. Now, to some degree, that's true, but it's not completely true. But because it was sort of as a cognitive problem, it was thought that anyone who had ADHD had to be doing poorly in school. And so if a kid was not doing poorly in school, they don't have ADHD. In fact, a lot of kids were described as lazy or they're bad boys and things of that sort. It caused a lot of stigma because of thinking they could not possibly have ADHD. And my mother was a kindergarten teacher at the time when kindergartens were starting to get competitive. Parents wanted the kids to learn this, learn that. And she would say, I really don't care if the kid knows their alphabet or any words by the time they leave. I just want them to enjoy school and have friends. And she was absolutely right. It's a definitely red flag for something's not right.
So that makes it all the more important. The next question I have for you, which is if you get treated early, does that change your psychology? Does that change the neuroscience of your brain?
Let's talk about how it changes behavior and the impact on the child. And we can downstream, we can talk about the actual brain itself. In terms of child behavior, if a child has ADHD and they're given one of the medications for treating ADHD, what parents will typically find is that the child behavior improves at home and at school. They start to do better at school. Those are some more immediate effects. Making friends takes longer because that doesn't happen overnight. When I say immediate, I'm talking maybe 4 to 6 weeks. They'll start to notice positive changes. For example, the child sitting down doing homework or obeying the parent, listening to what the parent has to say. They'll see that within 4 to 6 weeks if they get the right treatment. Making friends, getting integrated into a social life takes longer because see, it depends on how much the parent has delayed treatment. If your child has ADHD starting, say, at 5 and you delay it till 10, they've had 5 years being ostracized, stigmatized, not making friends. It will take a while to undo. But little by little, it will get undone. Things will get better. The goal of treatment is not just to change the symptoms, not just to make the child more attentive, it's to improve the child's life. By any metric studied in the world of ADHD, whether it's kids or adults, people's lives get better usually when they're given the appropriate treatment.
Yeah, there's a certain toll of having that negative feedback from the outside world every day. Do you think that you can talk about that in terms of neuroplasticity?
The question becomes, why are people getting better? Is the brain actually getting better? It's difficult to study because the ideal experiment is you have some kids on medication for 10 years and other kids not, and you compare their results and you do it all randomly and it's a controlled experiment. We can't do that because it's not ethical. The best information we have is just looking at kids naturalistically. What happens to kids who are treated with medications? Some data from Dr. Shore from the National Institute of Mental Health followed kids longitudinally. He's a guy who does brain scans. Images the brain, actually looks at the structure and function of the brain. And what he found was that the children whose brains were improving, meaning they were getting more typical, more neurotypical, those kids were more likely to remit their ADHD symptoms and not need medication later in life. The kids who were not taking medication, their brains tended to stay atypical. Because of that, we think the atypicality of the brain is one of the causes of the symptoms. They tended to maintain their symptoms. It wasn't a complete black and white finding, but generally the inference was the medications weren't hurting the kid's brain. If anything, they were helping the child's brain to develop in a more typical fashion. I just want to mention to the listeners, plasticity is the ability of the brain to change in response to what the environment is demanding of it. Our brain is more plastic when we're younger than when we're older. When we're younger, the plasticity of the brain helps us learn, helps us control our environment. These are all important executive functions, which we may talk about later, are improved with brain plasticity.
Do you feel that parents should go first with medication or give behavioral therapy a try with young kids?
So, okay, guidelines from the American Academy of Pediatricians and from the American Academy of Child and Adult Psychiatry and other guidelines from around the world all say you start with medication first. The only exception being the American Academy of Pediatricians suggests that for very young kids, like under 6, you try family behavior therapy. If that doesn't work, you switch to medication. That actually is not an evidence-based guideline. The evidence suggests even for the younger kids, they should take medication.
Wow.
At our last World Federation meeting, we had a very interesting debate between two people. One who was saying preschool kids should get medication first, someone else saying no, they should get behavior therapy first. And at the end of the debate, the moderator asked the audience, based on what you've heard, preschool kids should get medication first or not. By probably 5 to 1, the audience said they were convinced it was medication first. And this was an audience of psychologists, not just psychiatrists and medical people, even people who have a strong belief in the ability of psychological therapies to work. They realized the evidence was pretty strong in favor of medication being helpful for these very young kids.
But even if you do medication first, I would assume that you would recommend that parents also go in for maybe some parent coaching or behavioral modification for the child, what do you recommend as an accompaniment to medication?
I don't see patients anymore, but when I did, my approach was, I'm a psychologist, by the way. I would tell the parent, let's see what happens on the medication. It's possible that medication solves all your problems and you don't need anything else. In some cases, that's true. For milder cases of ADHD, that can be the case. In other cases, particularly if treatment has been delayed and the child has developed bad habits and low self-esteem, other kinds of approaches are needed. I say, wait till the smoke clears. After the medication takes effect, we're not talking a long time, 4 to 6 weeks. You'll get a sense of how things are going, and then we can talk about what might be a useful approach from a psychological approach.
That's really interesting that kids might need more help, therapeutic, if treatment has been delayed.
That's right.
Cynthia, do you have any questions that you'd like to ask?
We were trying to have a model where we educate the parents about ADHD in girls because it's hard to rely on the schools to do that. Do
Mhm.
you think that's a reasonable approach? It sounds like you're saying most diagnoses get started because the schools point something out to the parents.
That's right. As Catherine mentioned, the teachers are overloaded already, and to ask them to do something else is very difficult. The parents are the ones who are going to be the real advocates for their own children. If they learn about attentive ADHD and they know what to look for, they know what questions they can ask the teacher, I think that's a very good approach to take.
Can you think of anything else society should do to make sure girls aren't slipping under the radar?
Yeah, if we think that pediatricians and child psychologists are the first port of call for a child having trouble, the education there needs to be better. And the education is very different in different places. It's not bad in pediatrics because pediatricians have been treating ADHD for a long time. But I would look at residency programs in pediatrics to see what they're actually teaching. Cynthia, for example, your coalition could maybe do a survey and figure that out. What's being taught to pediatricians about girls with ADHD? Are they up to the latest information? Or do they adhere to older ideas that it's rare in girls? I'll tell you how bad it was in the 1990s when I was at Harvard and Mass General. We submitted our first grant to NIH to study girls with ADHD. It came back, and one of the reviewers literally said, "Why would you want to study ADHD in girls? It's a disorder of boys." They didn't want to give us the money because of that. So what we did was we had to scratch around, find some small funds to do a pilot study to prove that this was worth studying. We did that and actually published papers about it, and then they gave us the money to do a much bigger study.
Now that we know it is a serious problem, is it serious enough so that pediatricians should be regularly screening girls at a certain age?
I think that actually girls and boys should be screened for ADHD early in life because it's a common disorder, right? It's at least 5%, we'll say 5 to 10%, depending upon estimates. It's a common disorder in kids, starts early in life, and it predicts lots of bad outcomes if it's untreated. Why wouldn't you screen for something like that? It's really common sense to do that. It
What
really
age
is.
do you think is
So
appropriate to do that?
One of the concerns I have in general about psychiatry stems from a survey we did in our clinics a while back. This was an older survey, maybe 15 years old. We found that the average time between the onset of a disorder in a kid and treatment was 6 years. That's how long it took for the child to get to treatment.
What treatment? The average time of?
Between the onset, in other words, the first signs of the disorder and the kid getting into treatment was 6 years. Some of that time was maybe because it wasn't really clear what was happening, but in many cases, we know just from histories that they've been impaired for many years. It took the parent a long time because the treatments for ADHD have been heavily stigmatized. And many parents are afraid of them. They're afraid, oh, if my child takes a medication, what's that going to do to his brain? It's going to hurt him. The internet is filled with this misinformation. My attorney, I was friendly with, called me up like 8 years ago and says, I'm really concerned that my grandson has ADHD. And my daughter keeps taking him to every alternative practitioner in the San Francisco Bay Area for the last 5 years. Nothing seems to be working. And she just refuses to take him to see a regular doctor about it. And I said, geez, that's going to be a difficult problem because people who have that point of view are hard to change. It's almost like a religion with them. But I said, oh, I'm happy to talk to her. I basically said to her, look, I understand your concerns. You're worried about the medications. The medication that the child's likely to be put on has been used for 50 years or more, and it's totally safe, both as determined by the FDA and years of use. I gave her the facts about how it stops problems in the future and so forth. But I think what convinced her was when I said, look, you don't have to give it to your child for life. You can give it for one day. And if something bad happens, you can stop it. Nothing bad's going to happen in one day, but you could stop it after one day. You could stop it after a week, after 2 weeks. I recommend you at least try for 2 weeks, ideally 4. But rest assured, you can stop it if you want. She said, yeah, that makes sense. I never thought about it that way. I didn't know what she was going to do, but I get a call from her about 6 weeks later. She said, I had to call you to thank you because, oh my God, my son is so much better. I wish I had done this 5 years ago. It's such a common story because the child responds to the medication. It's going to change their lives for the better.
Dr. Frum, can you talk more about medication? We've been interviewing people in the field and they're still saying parent training first. For you to say medication, even medication for 3-year-olds, is radical from the general state of knowledge, could give us more
Yeah.
assurance of where
Well,
this comes from, what the research is, and how long people have been feeling this way. That would be helpful, even to me, to be out there
sure,
advocating for the
sure,
medication. I do, but
sure.
I was thinking it should be parent education first, and now yeah, I'm conflicted.
There are many of my colleagues out there, professionals out there who are treating kids just not up on the information about the disorder because they learned something in graduate school from a professor who learned something 50 years ago. They somehow think that's right. They unfortunately are not up to date. If we put the preschool kids aside where there's some debate, anyone that's older than say 5 or 6 years old, the treatment guidelines that which I agree with from the 2 top organizations in the United States all say you start with medication first.
What about the people that are still citing the multimodal study then? That seemed like the gold standard, and now what you're saying is different.
What's known as the MTA study, the
Yes.
multimodal treatment of ADHD, to help your listeners understand the way clinical trials work. At the very beginning, you say, here's what I think is going to happen. I'm going to give children this treatment, and I'm going to use this outcome measure. Usually it's a measure of ADHD symptoms, and that's going to be what I want to see change. I'm going to use that to determine whether or not one treatment is better than the other, or we should use combined treatment. MTA laid that all out. They did the study. And when the study was over, what they found was that when you treated kids with behavior therapy plus medication, they didn't do any better than when they had medication alone. Subsequent to that finding, some of the people on that committee did more analyses, looked at it different ways, and said, if you look at it this way, multimodal treatment is better than medication alone. But that's a little bit of cheating. For example, a drug company could not get away with that with the FDA. You can't just cherry pick results that fit your idea. You have to look at the full literature that's out there. You look at meta-analyses that have looked at the ability of family behavior therapy to help kids. At best, it says it works a little bit. But if you look at some of the more recent studies, it suggests that it doesn't really work at all for symptoms of ADHD. I'm a behavior therapist by training. It works great for lots of things. It just doesn't work on ADHD symptoms the way medicines do. Medicines, for example, on a scale of 1 to 10, methylphenidate or amphetamine, which is Ritalin or Adderall, those medications are like an 8 or 9 or a 10, depending upon the child. Whereas behavior therapy, if it even works, it's more like a 2 or a 3 if you get lucky. It's just not effective for the symptoms of ADHD. One can always try to dispute it, but you can't dispute it based on one study. That's just not the way it works. We work on combining information as much as possible. That's why I created this international consensus statement on ADHD, which got 87 experts from around the world to say, what are the basic facts? We had 208 basic facts about ADHD. And one of them is that medications really work well and behavior therapy doesn't work well. That's what the data say.
Can you tell us the 2 professional organizations that recommend this are which ones
American
again?
Academy of Pediatrics,
Uh-huh.
the American Academy of Pediatrics, AAP, and the American Academy of Child and Adolescent Psychiatry,
Well,
known as ACAP. They say medication first, except there's some debates about the preschool.
what would be helpful for us is if you could say how important it is, if we could get the quote from you, how important it is for girls to be treated early. Why is this important?
It's important because it prevents many future problems and it solves the current problems the girl's experiencing, and it's potentially life-saving. People don't understand that about mental health problems. They say, oh, doctors save lives. Someone has a heart attack and they save their life because they did surgery and it's very dramatic. People's lives are destroyed by mental health problems to the extreme where some people commit suicide, of course. But even if someone doesn't commit suicide, their life can be totally wrecked from a mental health problem that wasn't dealt with. And honestly, I don't want to get parents too worried, but point is, this might happen. Every parent who doesn't medicate their child probably gets fire insurance for their house. They get fire insurance not because the house is going to burn down, because it might burn down. And guess what? It's more likely that your child has a problem from their ADHD than your house burns down. Invest in that as much as you invest in your home. Symptoms of ADHD, imaginary child, right? Girl or boy, 5 years old, ADHD is starting to emerge, having problems with kids in kindergarten. Parent doesn't get the kid treated, and they wait 5 years. Then child's 10 years old. Basically, you've let your child be impaired for half of their entire life. So they spend half of their life in impairment. And that's awful. I would tell a parent, you're what? You're 30 years old. That's if you had 15 years of life without getting treated for a disorder.
I really have
It's,
one last question for you because I
yeah,
know we're over our time. There's been some research about how people are less trustful of experts now, and trust in experts is really eroding. Do you think there's a danger that we'll go backward in getting diagnoses and treatments for kids with?
we live in a so-called world of alternative facts where people don't understand how to collect information or know if information is good or bad. It certainly needs to be in the curriculum of schools. But of course, schools have been politicized in many places. I have seen some curricula where they're trying to teach kids to understand what is evidence, what does it mean to know something is actually true or not true. But it is going to be a long uphill battle in the current climate that we live in. And we could very well go backwards. Every parent wants to do what's best for their child. If they start to hear some of this information, they should be able to understand the kinds of things we're talking about today. The media is to blame for a lot of this. It's not just the internet, right? The media will take someone who is an expert in ADHD and they'll say, we want to have a balanced discussion. They'll bring in someone else who has totally off the wall ideas. Then the audience doesn't realize that this person has been studying ADHD for 25 years and you're a world expert. Unfortunately, I'm a nerdy academic. I deal with data, information, facts. But you get somebody who's charismatic, who can tell a story that makes the parent cry. And guess what? They have a lot more influence on that parent. It's absurd.
So
It is totally absurd.
maybe there will be reason to write that book about the war on ADHD.
Yeah, we've go back to that. If you get people to read books anymore, I have my website, ADHDevidence.org, where I'm trying to educate the public about ADHD. I have some young people helping me with it because I need to understand the current method of communication. I've been told, keep it short, put it in facts, put it in reels, put it in short, engaging material. And even if you're not that engaging, at least if it's short, that's that's going to go over better. It's tough. It really is hard to get the message across.
I think you're doing a great job, and Cynthia's going to do a great job in getting it out
Yeah,
on social media. But ADHDevidence.org, I'm really glad you mentioned that website because
yeah,
it's good to
yeah.
have a trustworthy place. .org.edu, not .com.
That's right. And if you want to read the consensus statement,
It's been a pleasure talking with you.
thanks very much for your interest in this topic.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.